It's me, Dr. Catherine Toomer, family medicine and community health physician and founder of Total Weight Care Institute. And I'm making this video today. I am traveling and I have tried to do lives in the past, but I'm in a place where I know the Wi-Fi is not going to work. So I'm actually taping this, and I hope you will still leave your comments and still ask your questions after the video, and I will get to them as soon as I am able. But what I wanted to talk about was glucose dysregulation. And I talk about this a lot. People have been asking me questions about what's glucose dysregulation. Well, glucose dysregulation is a combination of metabolic, biological, biochemical, microbiological processes that happen in the body. And what it means is that when you eat food, particularly carbohydrates, your body then breaks it down, digests it down to its smallest component, which is glucose, and then that glucose goes into the blood, and that blood then travels around the body, giving signals to your brain, and then your brain tells your body what to do in order to manage it. Now, when there's a dysregulation, there's a couple of things that happen. Either the glucose is hyperabsorbed, meaning you absorb too much of it. Once it's in your bloodstream, your body can't do anything with it because the mechanisms that are put in place by your body to fix that blood sugar don't happen, or the message doesn't get to your brain, the cells in your brain to tell your body what to do. And usually that involves insulin. And so what insulin is a substance that your pancreas produces in order to help your cells use blood sugar. But when your cells can't use the insulin, the blood sugar stays high and your brain still doesn't get the message, and it makes you act in a way to make it higher. So when you have a combination of high blood sugar plus high insulin trying to control that blood sugar, your body makes fat. And this happens on a continuum from pre-diabetes, which is a genetically predisposes people to that. And it goes all the way through to diabetes or uncontrolled diabetes. Now, often what triggers this is a combination of nature and nurture, or lack of nurturing. So what happens is if you're genetically predisposed and your body gets exposed to different environments that trigger the expression of that gene, then it can make you more sensitive, more susceptible to glucose dysregulation, therefore fat production. Then fat production in and of itself creates another insulin issue, creates another endocrine issue, which then drives your sugars up even more, which makes your body make more fat, and it will keep going in what really a quadrangle to push you towards diabetes. So what happens is, one, you eat blood sugar or carbohydrate. Two, that carbohydrates broken down into blood sugar. Three, your insulin levels shoot up in order to try and control that blood sugar. Four, your cells can't use that insulin in order to drop your blood sugar. Or what happens, it uses it too well and your blood sugar drops really, really low. And then then your liver kicks in saying, wait, you got low blood sugar. So I'm going to kick in, and then it overshoots, so you get high blood sugar again, even after it's already dropped. And so all of this happens in a way, and depending on where you are in the continuum will determine what's happening. So you can actually be on the way to diabetes and have low blood sugar because you're pre-diabetic or you're insulin resistant. So in order to diagnose diabetes, you have one of two things: a hemoglobin A1C over 6.5 or consistent fasting glucose blood sugar readings over 140. If that's just fasting only. With insulin resistance, you can have blood sugars as high as 200. You can have insulin levels way high, but your hemoglobin A1C would be low. So a low hemoglobin A1C with high blood sugars is insulin resistance. A high hemoglobin A1C, even with low blood sugars, is diabetes. So I hope that makes sense. But so if you're trying to figure out where you are on the continuum, a fasting blood glucose level with a free insulin at the 1 hour mark would be, sorry, not a fasting glucose tolerance test. It's a fasting glucose tolerance test, but actually a non-fasting is even better. So a glucose tolerance test with insulin levels, which then check to see if your insulin levels are high, if your blood sugars are high, but in the face of low hemoglobin A1C, that is insulin resistance. And if it's high hemoglobin A1C, regardless of anything else, that is diabetes. If you have high blood sugar, that are fasting high blood sugars, then you have diabetes. Now, fasting blood sugars can be falsely low in insulin resistance, but never with diabetes. They have to be high with diabetes if the hemoglobin A1C does not match. All right, I hope this makes sense. I will try and explain this even better if I can later, but you can put your comments, put your information in the comments, and I will come back and circle back and make sure that they get answered. All right, you guys have a good evening, and I'm going to enjoy the rest of my vacation. Bye.